The African Mission Healthcare Foundation began to support medical work in South Sudan in 2010. Our first partner was the clinic run by Dr. Rob Condon and his team in Doro, Upper Nile State. The Doro Clinic sees 30,000 patients per year and will open a maternity center in 2013. Based on this success, a generous donor was interested in scaling up other health interventions in South Sudan. In 2013, we will add 7 new partners. Over 3 years, we hope to provide the Indeed and Truth Clinic in South Sudan with funds to expand its clinic facilities, add inpatient wards, train 3 physician assistants, and increase its capacity to 45,000 patients annually. Much needed funds will allow Memorial Christian Hospital in Rilkuk to upgrade its airstrip, allowing year-round delivery of supplies and medical personnel. Other resources will allow expansion of housing, administrative, and clinical capabilities at the site. Medical workers from World Gospel Mission in Kenya will assist Indeed and Truth Clinic and the Memorial Christian Hospital. Dr. Russ White and his team will make 5 trips in 2013 to operate at Memorial Christian Hospital. Cataract teams will also go to the region. Dr. Jill Seaman of Sudan Medical Relief is an expert in the treatment of the parasitic disease Kala-Azar. Her clinic treats thousands of such patients, as well as those with malnutrition, tuberculosis, and other infectious diseases. Grant funds will assist with purchase of medications and payment of staff. Mother of Mercy Goodell Hospital in the Nuba Mountains is on the edge of a war zone and sees thousands of casualty victims every year at this busy general hospital. Grant funds will pay the majority of nursing staff costs in 2013. Catholic Medical Mission Board operates an antiretroviral therapy clinic for patients infected with HIV in South Sudan. The clinic focuses on prevention of mother-to-child transmission of the HIV virus. Using grant funds, CMMB will turn its attention to reducing maternal and child mortality more generally by training traditional birth attendants, developing a referral system, and renovating a local maternity clinic. Dr. Mark Newton is a missionary anesthesiologist working at Kijabe Hospital in Kenya. Several years ago, Mark began the first nurse anesthetist training program in Kenya. Now, in collaboration with the Ministry of Health of South Sudan, Dr. Newton and his team will train 15 South Sudanese nurse anesthetists every year. These nurse anesthetists will then be able to return to South Sudan and remove one of the major barriers to safe surgery and safe delivery in that country. Although there are many uncertainties and obstacles to overcome, we anticipate that this partnership between the African Mission Healthcare Foundation and its on-the-ground partners will, over the next 3 years, facilitate 130,000 outpatient visits, nearly 7,000 hospital admissions, reach 6,000 pregnant women and newborn children with quality medical care, allow for nearly 6,000 operations and cataract surgeries, and treat thousands of patients with Kala-Azar and other infectious diseases. In addition, we aim to train dozens of traditional birth attendants and nurse anesthetists and educate 500 community health workers who in turn can teach their own communities. All this will lay the groundwork for what we hope will be years and decades of quality access to medical care in the future for the people of South Sudan.